I'm Dr. James Markham, and welcome to Mission Sonlight Wellness. Today we're going to talk about acute respiratory infections. Well, why is this important? 18.8 billion people a year suffer from this type of infection. It causes children to miss school, causes adults to miss work, and we can't do the things we want to do because we don't feel well. In fact, it's the most common visit to a doctor's office each year. In children, it's especially dangerous because it can lead to pneumonia. In fact, in Kenya, 21% of deaths of those less than 5 years of age were from pneumonia, and this often starts from an upper respiratory infection. In medicine, we give different names to the types of infection depending on where it's at. If it's in the sinuses, we call it sinusitis. In the throat, pharyngitis. In the ears, otitis. In the lungs, bronchitis. An upper respiratory infection is, in fact, a common cold. In fact, viruses are usually the culprit. And there's about 200 different viruses that can cause these problems in our upper respiratory system. The one most people are familiar with, the common cold virus, is the rhinovirus. Virus is very difficult to differentiate from bacteria at times, and often doctors give antibiotics where they should just wait these infections out. But remember, these infections are very dangerous, and in children, they can lead to pneumonia, and they also can spread from person to person. We call that being contagious. Usually, the symptoms happen 1 to 3 days after exposure and can go on from 7 to 10 days. The symptoms might be a cough, a sore throat, fever, lots of mucus from whatever. And remember, the pathogen, which is a virus or a bacteria, makes the immune system turn on, and all these inflammatory cells cause our symptoms. Sometimes the diagnosis is difficult because an allergy can look like an upper respiratory infection. But in an allergy, we usually don't have a fever or muscle pains, usually don't have a headache. In a virus, usually we see the muscle aches, your fever, fatigue, headaches as well. Now, bacteria can have all of these features too, but in a bacteria, usually you have a fever, and usually when you bring up mucus, it's a different color, usually yellow or green. Well, for viruses, which are 90% of the upper respiratory infections, we just support a person. We strengthen their immune system. Sometimes if you have a symptom like a cough, honey can be used, but there's no real proof for some of the supplements like echinacea or zinc. Sometimes a doctor will use a symptom like a medicine like amantadine, but that's just for influenza type A. And then if the mucus turns colors, or if you have a bad fever and an infection is suspected, the appropriate use for antibiotics. Upper respiratory infections from strep, H-flu, those are very common ones that we use antibiotics for. But nowadays, we often see overuse of antibiotics for bacteria, and this can lead to resistance. One of the things I think is very helpful is when you have an infection, try to get it out of you. Try to cough it up. Nasal saline washes are very helpful. Get those mucus and those bad boys out of your body. Finally, the key to upper respiratory infections is prevention. We could prevent most of these infections by careful hand washing, getting enough rest, eating healthy foods, avoiding processed foods, especially sugar, avoiding people that are sick. Some studies out there showing that probiotics are very useful. We also want to avoid things that weaken our upper respiratory system, especially cigarettes. And then if we're exposed to a virus and have those symptoms, we want to do all the things for prevention as well. And this will help us most limit the damage done and the spreading of an upper respiratory infection. Well, I hope this helps you out a little bit understanding what an upper respiratory infection is, why it's so important, and I don't want you to be one of the 18.8 billion that suffer a respiratory infection this year. If you have questions, go to our website. That's heartwiseministries.org.